Think and plan. Medical research starts with a study question. A good question will lead to an answer that positively impacts health. For example, is drug A more effective than drug B at treating a particular disease? To answer this, a researcher must test both drugs on patients. Very large studies may involve global teams of researchers and thousands of patients. It is critical that the researchers design the study to isolate the impact of the drug as much as possible. For example, if people receiving drug A live in a high-income country with good healthcare, and those receiving drug B do not, it is possible that drug A may appear to be better, but in reality, they are just seeing the impact of general healthcare. Discover and analyze. A well-designed study will produce meaningful data that can answer the question posed by the researchers. However, it is vital to analyze these data correctly in order to discover any relevant information that may impact health and well-being. Interact and validate. Researchers can publish a draft of their work online so that other researchers can use the data quickly without waiting for publication in a journal. Such drafts are called preprints and are usually published in dedicated preprint servers. Write and publish. Next, the researchers write about their study in the IMRAD format, explaining why they conducted the research in the introduction, how they conducted the research in the methods, what they found in the results, and the implications of their research in the discussion. After this, they look for an appropriate biomedical journal to publish their work, so it can be seen by other researchers. At Karger, we manage around 100 biomedical journals to which researchers can submit their work. Some are highly specialized in a medical field, while others are more general. A key function of the journal is to search for flaws in the study design and analysis, and only publish papers after such flaws have been corrected, or refuse publication if the flaws cannot be fixed. This is extremely important, as biomedical research can have a huge impact on people's health and well-being. The initial review is carried out by the journal's editor and the board. If the paper is of interest, it will be sent to external experts for an independent, detailed review. This is called peer review. It is not easy for researchers to get their work published. Approximately 70% of the articles submitted to Karger are rejected for publication. Some prestigious journals, such as Nature, will reject 95% of papers submitted. Being published in top-flight journals can be a huge boost to a researcher's career. Let's assume that the research paper comparing drugs A and B was accepted. After a paper is accepted for publication, it's edited, formatted, and links are added. Now it's called an article. The article appears in the section of the journal's homepage called Online First. The article will remain there while waiting to be assigned to an issue of the journal, along with other articles. A journal may publish several issues per year. When the article is published, it leaves Online First and appears in both the online and printed versions of the journal. Subscribers receive either the physical printed copy or a notification that the issue is online. Share and discuss. So, our article is available on Karger's website, but some fields publish hundreds of articles a month across a large number of journals and publishers. So, how does a researcher find articles of interest to them? One way is Karger's Table of Contents alerts, which anyone can subscribe to. Researchers often subscribe to these alerts for key journals in their field. However, the main route is via scientific databases such as Medline, Web of Science, and Scopus. These databases are searched by biomedical scientists to find articles of interest. Normally they have set search criteria and are automatically notified when an article matching their criteria is received. Part of Karger's role as a publisher is to provide these databases key information about every article via metadata in an accepted format. The future of publishing. The traditional role of scientific publishers, including Karger, has focused on publishing articles in journals. in particular the write and publish and share and discuss parts of the research cycle. However, in the digital age, publishers are expected to provide their authors with more services to ensure their work is read. Karger's strategy centers around choosing which services to add to our portfolio by conducting careful market and competitor analyses. We will cover this strategy in more detail in the upcoming videos.